Golfer's elbow, or medial epicondylitis, is one of the more common conditions that we see this time of year as more and more people are out playing. So today I want to go over the 5 steps that we go through in treatment here in the office to get you over this condition, but also get you back out playing and preventing this issue in the future. The first thing we're going to do is calm this down. This is typically an issue of doing too much too soon. We go from not playing in the winter months, maybe not even in the spring, and then we get the bug and we want to go out and practice, and we go from hitting no balls to hitting 200 balls at a time and doing that a few times a week, and before you know it, we're starting to get elbow pain. Tendons and muscles respond to the stimulus that's given to them. So if you're doing too much, it's going to respond negatively. And this is a great way for your body to tell you, hey, you're trying to do too much. We need to calm it down. So that is the first step. We're going to take a short little break. We're going to calm this down, get the inflammatory process over with, and then start building back into our golf. The second step in getting you over golfer's elbow is the hands-on component, the things that we're going to do here in the clinic regarding the muscle and the tendon and how we calm this down and build this back up. Some of the tools that we use are going to be soft tissue mobilization with an instrument. A lot of people just call this scraping, where we go through, scrape the area, try to loosen it up, bring some blood flow to the area. But this is a really great tool to decrease the sensitivity from the pain that you're feeling. Another tool that we use, this is a great one for when you leave the office. It's a great reminder that you need to keep giving this attention, but we can use kinesio tape to offload this area a little bit, give you a little tactile stimulation to help with that pain, and also, again, remind you to do the things that we're going to tell you to do at home. From there, really the things that I find are most effective that I'm using more and more with this, because it just brings about faster results, is going to be dry needling. That allows us to get deep into these muscles to stimulate a neurogenic response, but also bring some circulation into that muscle that may be tight that we can't work with a tool or dig into with our hands. I typically just find dry needling makes things go faster for us, which is really what we're all looking for as athletes. And then the new gold standard, especially when it comes to the tendon, is shockwave therapy. This allows us to use an acoustic wave to get in there to stimulate circulation, to cause a healing response, and to really start regenerating that tendon. So this has become the tool that I've liked the most with dry needling here in the clinic as far as the hands-on component, so that we can get you through this faster. The third step in getting over golfer's elbow is restoring mobility. Now, we're not necessarily going to be dealing with the elbow and any loss of range of motion here. Most people tend to have full flexion and extension, and even have good pronation and supination through the arm. So what we're typically going to be dealing with is our middle back, our shoulder, and our wrist. Those are the areas that if we're lacking mobility, we're going to try to make it up somewhere else, and that can typically happen at the elbow with corrections in our swing, putting more stress here. So if you sit at a desk all day and you feel like you're flexed, we really need to work on extension, but we also have to have that rotation, obviously, for our swing. From there, what does our shoulder mobility look like? That always needs to have good range of motion and have attention given to it, because if our shoulder isn't moving well, it's going to come down the chain and cause us some problems. Lastly, wrist mobility. That's where most golfers tend to have a lot of issues. Maybe they've sprained their wrist, maybe they've broken things, maybe they have hardware in there that prevents them from moving the way that they should. A good swing coach can help you get around that, but if you're lacking any kind of wrist range of motion, that will come up the chain to your elbow and even sometimes in your shoulder. So those are areas that we need to address when we're dealing with the elbow that most golfers don't think about, is what's happening below the joint, what's happening above the joint, and how do we need to address that. The fourth step in getting over golfer's elbow is building strength capacity. Now, most of us do some kind of strength training. I love that golf is incorporating more and more and more strength into the routines, not only to prevent injury, but also to boost performance. But when you look at tendon injuries do not respond well to rest. When we do the hands-on care here in the office, that has to be followed by improving your strength. Tendons respond to load, we have to load them up. There are specific steps we want to go through for isometrics, bent arm, straight arm, and then how we incorporate normal exercises back in, and then also getting back into swinging and swinging more and swinging harder. So you have to build up that strength capacity to handle all of that stress of playing golf. The fifth and final step that we'll do here in the office to help you get over golfer's elbow, and this is actually something we'll just recommend that you do at home. Most of us, when we sleep, curl up into this decorticate position, which is usually pretty comfortable. But what we find is if you're dealing with golfer's elbow, you're pulling through this tendon all night long because it is getting stressed as you are in this flexed position. If we can get to where you can sleep with your arms straight, that will make things go faster. I started doing this a few years ago after I learned it from Dr. Greg Rose, who's the doctor that created the Titleist Performance Institute program. And once I started doing that, I started seeing golfer's elbow coming around a lot faster. People were able to progress through the exercises faster. I didn't have to dry needle as much. I didn't have to shockwave as much because at home, they're actually getting some rest at night. Now, I will say most people say they can only make it about halfway through the night, which is fine. But if we can get a soft brace from Amazon or CVS or Walgreens that has the removable bars, and you can keep your arm fairly straight and sleep 4 or 5 hours with that on, that is going to speed this process of you getting better. So the in-office care matters. The strength definitely matters. Slowly progressing back into golf definitely matters. But the sleep component, if you're not sleeping, you're not going to recover. And if we're pulling through this all night, it's just going to take longer. So that is the 5th step, is find a way to sleep with this straight for 2 to 3 weeks.